Okay, I tried to record this twice on Canvas and it didn't work, so hopefully this one works. So for me, looking at what we've learned throughout this entire course, and I think the biggest takeaway that I have as far as why people should care about the disparities in healthcare is really the human factor of whether you're a woman or you're not. Everyone knows a woman, everyone loves a woman, everyone has a woman in their life who's important to them, whether it's your mother, your grandmother, your sister, your aunt, your cousin, your friend. Like, we all are impacted, and our lives are all adjacent to women. And so it's important for us to understand the disparities that they face, so that we can better advocate and support the women in our lives and the women in our communities, and help be part of supporting and implementing public health policies that will go to empowering and like bettering their lives. And we kind of see these disparities all throughout the life cycle. When we look at, like, when we were talking about adolescent health and the rate of suicidal ideation and having a plan and suicide attempts being higher among young girls, and then higher among different subsets of ethnicity among girls as well. We see these different pressures that women are facing, and then we know within the healthcare system and within mental health care that women are given this characterization of being hysterical, of girls being too emotional, and their needs and their mental health concerns not being appropriately addressed. And you pair that with young girls experiencing these much higher rates of suicidal ideation and attempts. And it's important for us to understand the root cause of those and to understand the disparities that they're going to face in accessing care and treatment, so we can better support the girls that are in our lives, and help them to be able to have the supports that they need. And if we like move forward and keep going, like later in life when we look at pregnancy and access to reproductive care, that very much matters if you are in a relationship with a woman. If you ever want to have a baby, or if you don't want to have a baby, having access to those services is incredibly important. And then when we look at the experience of pregnancy, the experience of birth and maternal mortality being so much higher for Black women, being having worse outcomes in hospitals that largely serve women of color, and even white women having worse experiences and worse outcomes within those hospital systems. And then understanding that the lack of postpartum care also contributing to that maternal mortality, and a lack of those resources in a lot of communities, along with the lack of social supports that can increase instances of postpartum depression, which can cause a lot of issues for mom and baby, not only emotionally, but also it is a tax on healthcare dollars that are then spent to potentially address life-threatening emergencies that could have been prevented if appropriate and quality care was given without experiencing the impact of these disparities. And so it helps us as people within communities to better serve and support and advocate for these policies, and help with organizations that are addressing them. And if we go all the way like to the end of women's life, when we look at perimenopause, not that's the end of life, and like menopause and the impact of that change, those hormonal changes on the women's brain, and the introduction of risk factors that make them more at risk for developing Alzheimer's, which we know impacts women more than it does men, and the emotional tax that has on a family, and then the cost of care, both with like Medicaid and like Medicare and state funded plans, as well as like the money that comes out of families in order to provide care. And we know that all women will go through menopause, right? All women are going to experience this change. but there's not enough dollars that are going into understanding the changes that happen in a woman's brain during perimenopause, during menopause, and ways that we can help kind of mitigate those changes and provide protective factors so that women are not experiencing such high rates of Alzheimer's. And that starts all back like at the upstream, like keeping people from falling off the cliff to begin with. And that has to be a priority within our society. And that starts with individual people caring about and advocating for the changes and the supports that women need in order to have more equitable access to healthcare. For college women, I would give the advice of just, you know yourself, you know your body, and you are your best advocate to continue knowing what your risk factors are, knowing what the risk factors are for women in general, and your specific risk factors based on genetics, based on family history, based on environmental things and your own medical history, and not being afraid to advocate for testing, advocate for what you know your body needs. And if you go to a doctor who isn't helpful, to not give up, to keep pushing and to keep fighting so that you can receive the care that you need, because you are the advocate that you need. And it's okay for doctors to think that you're difficult, because you're advocating for yourself, and the right doctors who are going to listen to you won't think of you that way. So keep pushing until you find those right doctors.